Welcome to the Deep Dive, where we plunge into complex topics to distill the essential knowledge you need. Today, we're navigating a hidden world, the tiny, often unseen organisms that silently impact a foundational pillar of global agriculture: cattle. It's an issue that's not only fascinating, but carries a surprisingly, well, staggering cost.
Indeed, these aren't just minor nuisances.
Yeah.
External parasites are major carriers for a whole host of really nasty diseases. They profoundly threaten animal health, welfare, and economic viability worldwide.
So, our mission for you today is to unpack the most common external parasites, the major diseases they transmit, their surprising economic impact, and the many different ways we're fighting back against them. We'll also look at the emerging challenges and what the future holds in veterinary parasitology. Get ready to see these tiny creatures in a whole new light. Let's begin by understanding the most immediate threat these parasites pose. You'd think maybe a few flies wouldn't make much of a dent, but what kind of damage do these common external parasites really inflict, and what does that mean for the animals themselves?
Well, these aren't just minor irritants. They cause profound stress and discomfort. This leads to injury as cattle try to relieve the itching and ultimately substantial production losses. Consider flies. They're truly pervasive pests causing major economic losses. Their rapid life cycles mean swift population expansions. For instance, horned flies complete their cycle in just 10–14 days in hot weather, laying eggs in fresh manure. Stable flies, on the other hand, they tend to breed in damp, decaying vegetation and manure.
So, rapid reproduction is a key factor then, making them incredibly difficult to control. But beyond just the numbers, what does that actually mean for the cattle themselves? How does an infestation, look on an animal? What's their daily life like when dealing with it?
Flies cause significant fly worry, forcing cattle to spend energy on avoidance behaviors, things like stomping, twitching, constant movement. They do this instead of calmly feeding. Horned flies take up to 40 blood meals a day. That's constantly interrupting grazing and reducing weight gains by up to half a pound per day.
Half a pound a day, just from flies.
Yeah, it adds up fast. And stable flies inflict painful bites, causing cattle to stamp their feet and switch tails constantly. Heavy infestations can lead to a 15% body weight loss due to blood loss and just the sheer disturbance to feeding. And it's not just discomfort face flies. By feeding on eye and nasal secretions, transmit the bacteria causing pink eye.
Pink eye, right. That's a painful eye infection. Considering all that direct irritation and blood loss, the financial hit from just these flying pests must be staggering, right?
It truly is. Flies are among the most economically damaging insect pests of cattle. Annual losses to the U.S. cattle industry are estimated at approximately $6 billion.
$6 billion?
Yes. To put that into perspective, that's more than the entire annual revenue of some major agricultural corporations, all wiped out by tiny flies. It really highlights how seemingly minor irritations can aggregate into a staggering silent drain on the industry. Horned flies alone are the most damaging to pastured cattle, contributing over $730 million in annual losses.
We've seen the aerial assault of flies, but let's shift our gaze to another silent predator, one that lurks in the grass, often unseen until it's too late: ticks. What makes these tiny crawlers such formidable foes? They seem capable of bringing down entire herds sometimes.
Ticks are crucial vectors for numerous economically important diseases. What's critical to understand about them is their varied life cycles. Most are three-host ticks, meaning the tiny larva, the larger nymph, and the adult stage each feed on a different host. And the entire cycle can take up to 3 years.
3 years, wow.
Yeah, compare that to one-host ticks, like cattle fever ticks. They complete their entire parasitic stage on a single host in about 21 days. Then the adult females drop off to lay up to 3,000 eggs on pasture.
3,000 eggs from one tick, that's an alarming number. Beyond just annoyance, what does a heavy tick infestation mean for a cattle's health and daily existence?
It causes intense tick worry, which is a profound stress. That leads to significant blood loss and anemia. Affected animals become lethargic, they lose their appetite, and show exercise intolerance. Their very vitality is sort of drained by these parasites.
And the financial hit from ticks, is it comparable to flies?
Ticks also impose substantial economic burdens, absolutely. In Australia, for example, cattle ticks are the second costliest disease. They cause an estimated annual loss of $134.2 million there. The impact of even a single tick is surprising. It can reduce weight gain by 1 gram per day and milk production by almost 9 milliliters per day.
Just one tick.
Just one. And historically, cattle fever ticks caused over $3 billion in losses in the U.S. when adjusted to today's values.
Okay, what about the smaller, maybe less visible culprits like lice and mites? Do they also pack a punch or are they more of a background nuisance?
Oh, they absolutely pack a punch, both for animal welfare and financially. Lice are particularly problematic in colder months, spreading through direct contact in crowded housing. They cause intense irritation, itching, hair loss, and skin damage. Sucking lice, which literally feed on the animal's blood, can cause severe anemia in heavy infestations. They're essentially draining their vitality.
Wow.
Mites, on the other hand, cause deeply uncomfortable skin diseases known as mange or scab. Think of it as a severe itchy rash that leads to hair loss and crusty patches on the skin. Demodex bovis, a specific type of mite, for example, can cause visible defects.
Yeah, definitely. We've covered the direct attackers, but these parasites are often just the first act, aren't they? They're the delivery system for severe diseases that can devastate herds and silently erode profitability. Let's delve into some of the most impactful ones, maybe starting with anaplasmosis.
Right. Anaplasmosis is a really economically significant tick-borne disease. It's caused by a microscopic organism called Anaplasma marginale. This organism invades and destroys red blood cells, leading to progressive anemia and jaundice. It's found worldwide with an estimated global prevalence of about 38%.
38% globally, that's huge. And you mentioned something earlier, that calves under 1 year are often asymptomatic. Does the disease affect animals differently as they age? I wouldn't have expected age to play such a big role.
It's a key differentiator, yeah. Calves under 1 year are typically asymptomatic but become carriers, silently spreading the disease. Cattle 1–2 years old usually have mild to moderate disease. But those over 2 years old, especially adults over 3 years, are severely affected. We're talking a 30–50% mortality rate if untreated.
50%, wow.
Yeah. Early signs include fever, lethargy, pale mucous membranes. If untreated, this progresses to yellow membranes, rapid weight loss, and even aggression in severely anemic cattle. And pregnant cows might abort, adding another layer of loss.
That 30–50% mortality rate in older cattle is incredibly high. Does that alone account for the, what was it, $300 million in losses you mentioned? Or are there other, less obvious economic factors at play when a herd is hit by anaplasmosis?
Well, death loss accounts for the majority of the cost per clinical case, which was estimated at $660 in the U.S. back in 2016. But other factors include treatment costs, reduced production, and that chronic carrier status, which keeps the cycle going. Diagnosis relies on microscopic examination of blood, ELISA tests, and PCR. These are pretty rapid and accurate tests for quick diagnosis on the farm. Treatment often involves tetracycline antibiotics.
Okay. And what does prevention look like for something so widespread and with such varied impact depending on age?
There's a killed anaplasmosis vaccine available in the U.S. as an experimental product. It protects against the acute disease, but, and this is crucial, it doesn't prevent infection or carrier status. Live vaccines are used in some other countries. Vector control, like modifying tick habitat and using insecticides, is vital. And biosecurity is equally important. Things like using sterile, disposable needles, cleaning instruments between animals, and introducing only known anaplasmosis-negative cattle to negative herds.
Right, that makes sense. From one tick-borne blood disease to another, let's move on to bovine babesiosis, often known as redwater or tick fever.
Yeah, this is another severe tick-borne parasitic disease. It's caused by microscopic parasites called Babesia protozoa that invade red blood cells. They lead to hemolysis, the destruction of red blood cells, and severe anemia. One particular strain, B. bovis, is generally more pathogenic and can actually cause neurological signs. This happens as red blood cells accumulate and sort of clog up the brain's capillaries.
Neurological signs. Okay, that's serious. Where is this disease prevalent and how does it clinically manifest in affected animals?
It's widespread in tropical and subtropical regions globally. In the U.S., B. bovis and B. vagina were actually eradicated from most areas by eliminating the tick vectors. Now they persist only in a quarantine buffer zone along the U.S.-Mexico border. Similar to anaplasmosis, calves younger than 9 months are usually infected without clinical signs, with severity increasing with age. Clinical signs include fever, anemia, jaundice, increased respiratory rates, and with B. vagina, hemoglobinuria, which means red urine, hence the name red water, is pretty common.
Okay. What's the bottom line for babesiosis's overall impact on a farm then?
It causes significant morbidity, mortality, and major economic losses. In Mexico, its primary tick vector contributes something like $573 million to annual economic losses.
Hmm.
Historically, bovine babesiosis caused over $3 billion in losses in the U.S. Diagnosis involves identifying parasites in blood smears, PCR, and serological tests like ELISA. Treatment typically involves drugs like dimetazine acetate and imidocarb dipropionate. Though imidocarb has very long withdrawal periods, which is a significant practical concern for farmers.
Right, withdrawal periods are always a factor.
Definitely. Prevention strategies include immunization with live attenuated vaccines, often for calves, strict vector control using chemical treatments and pasture management, and biosecurity measures like maintaining closed herds and maybe even breeding tick-resistant cattle.
Now, to a disease that affects a truly vast region, African animal trypanosomiasis, commonly known as Nagana.
Right, Nagana. This is a debilitating parasitic disease caused by microscopic Trypanosoma species, notably T. congolans, T. vivax, and T. brucei. It's endemic in 37 sub-Saharan African countries, covering approximately 10 million square kilometers, a truly enormous area.
So tsetse flies are the primary vector, but what's really striking here, I think, is that the disease can spread in other ways too, which is not what you'd typically expect for something so tied to one specific insect, right?
That's right. While tsetse flies are the biological vectors, meaning the parasite develops inside them, other biting insects can play a role. Things like horseflies and stable flies can mechanically transmit trypanosomes through interrupted blood meals. This is especially true for T. vivax and T. avanci outside the main tsetse belt. Imagine a fly biting an infected animal, then immediately flying to an uninfected one. That's mechanical transmission.
Oh,
Plus, there's iatrogenic spread, meaning transmission via non-sterile instruments, and vertical or transplacental transmission from mother to calf can also occur.
what are the typical clinical signs we see in cattle suffering from AT?
Clinical signs usually include intermittent fever, anemia, enlarged lymph nodes, and significant weight loss. In chronic cases, you see progressive emaciation, decreased milk yield, and reproductive issues. Untreated animals with chronic signs often die, making it a really severe threat.
When we talk about sub-Saharan Africa, that's an enormous region. What kind of economic devastation does AT inflict on such a vast area?
It's immense. Agricultural economic losses from AAT are estimated at $4.75 billion annually in sub-Saharan Africa. In Ethiopia, for instance, bovine trypanosomosis causes economic losses of about US $80 per individual animal and over US $1,200 per household. This is primarily from mortality and loss of draft power, the inability of affected animals to work.
That loss of draft power is huge for small farms.
Absolutely critical. Treatment costs are high too, with an estimated 50 million doses of trypanocidal drugs administered annually in tropical Africa. Control involves chemotherapy and chemoprophylaxis, which is using drugs to prevent infection. But drug resistance is a significant and growing problem. Prevention strategies include vector control like spraying, insecticide-impregnated targets, and bush clearing to reduce fly habitats. Encouraging host resistance through breeding trypanotolerant cattle breeds like Ndama is also a crucial long-term strategy.
From systemic diseases spread by bites, let's turn our attention to something equally debilitating, something that directly attacks the animal's ability to even move. Digital dermatitis, often known as Mortellera's disease.
Right, digital dermatitis, or DD. It's a painful, contagious, superficial skin infection of the bovine foot, primarily affecting the hind feet. It's considered a polybacterial disease, meaning multiple types of bacteria are involved. It's strongly associated with various anaerobic treponema species. These are specific types of bacteria that thrive without oxygen. Skin abrasion and moistening, often from slurry or muddy conditions, are crucial for these bacteria to actually enter the skin.
What does an active lesion look like? And how is it classified to monitor its progression and maybe guide treatment?
Lesions are often painful, moist, they have a bad odor, and can range from ulcerated areas to something called hairy warts.
Hairy warts.
Yeah, it's a unique visual characteristic. They are classified using the M-stage scoring system, which helps vets understand the severity and progression. Active lesions, specifically M1, M2, and M4.1, are the ones most associated with lameness and pain. And it's highly contagious, spreading easily from cow to cow through direct contact, slurry, and even contaminated hoof trimming equipment.
This sounds like it could truly impact a dairy farm's productivity and, more importantly, the animal's well-being. What's the economic cost of something so painful and contagious?
The economic impact is significant, yeah. It's estimated to cost approximately $82 per case in the UK, or between $170 and $210 per case in the U.S. In the U.S., digital dermatitis costs about USD 1.4 billion annually, assuming a 25% herd prevalence, meaning a quarter of herds are affected. Losses include reduced milk production, for example, a 335 kilogram reduction in 305-day milk yield for heifers with DD, also poor fertility, and increased culling rates because cows simply can't function properly.
And you said no single effective treatment exists.
Right, that's part of the challenge. Treatment approaches vary, including topical or systemic antibiotics and foot baths, using approved disinfectants.
So if there's no single magic bullet, how do you prevent and control something so pervasive and contagious on a farm?
Control requires a comprehensive, sort of three-pronged approach. Keep it out, don't let it spread, and build resilience, meaning healthy skin. Keep it out involves strict biosecurity, like maintaining a closed herd, inspecting new cattle thoroughly, and ensuring equipment hygiene. Like disinfecting hoof trimming knives between cows, that's crucial. Don't let it spread. It means actively segregating cows with active lesions, disinfecting gloves, and using effective foot baths regularly. And building resilience means promoting healthy skin by keeping feet clean and dry, improving cow comfort through good housing, and building resistance through genetics and good immunity. Crucially, there is currently no vaccine for digital dermatitis.
No vaccine. Okay. Our final disease poses a different kind of threat, one that's often hidden in plain sight, slowly eroding herd health and economic stability. It's called bovine leukosis, and it sounds, well, far more serious than its quiet nature might suggest.
It is. Bovine leukosis is a viral disease caused by the bovine leukemia virus, or BLV. It's an oncogenic retrovirus. That means it's a virus that can cause cancer. Most BLV-infected cattle, we're talking upwards of 60–80%, remain asymptomatic carriers for life. However, a smaller proportion, about 0.1–10%, usually between 4 to 8 years of age, develop malignant lymphoma, which is a type of cancer.
If so many animals are asymptomatic carriers, how does it actually spread? This raises an important question about silent transmission within a herd, doesn't it?
It primarily spreads through the transfer of infected lymphocytes, which are a type of white blood cell. This happens via blood or blood products, often during routine farm practices like tattooing, dehorning, injections, or even rectal palpation, especially if you're using non-sterile equipment. Imagine a silent chain reaction across a farm where every needle, every shared piece of equipment could be passing on this virus.
That's a scary thought.
It is. Large biting flies can also transmit the virus mechanically. Vertical or transplacental transmission from mother to calf also occurs. And while BLV-infected cells are excreted in milk, infection of calves this way is thought to be of minor importance.
If tumors do develop, where do they typically appear in the animal, and what are the consequences of that?
Clinical signs of lymphoma are highly variable and depend entirely on the tumor's location. Common sites include the central or peripheral lymph nodes, which can become visibly enlarged, the obomasum, which is one of the cow's stomachs, the heart, which can lead to heart failure, the uterus, causing reproductive failure, and the spinal cord, which can result in paralysis or paralysis, severely impacting the animal's ability to move.
What's the economic toll of BLV, especially given its widespread asymptomatic nature, making it a kind of hidden drain?
BLV imposes a substantial economic burden, particularly in dairy farming. In the U.S., where BLV infection rates exceed 40%, annual losses just due to reduced milk production have surpassed $500 million. Overall, annual losses were estimated at approximately 283 20s per milking cow, leading to a $2.7 billion national deficit back in 2017. Indirect losses also stem from trade restrictions.
Right, other countries not wanting infected animals.
Exactly. BLV also induces immunosuppression, basically weakening the animal's immune system. This increases its susceptibility to secondary infections, adding another layer of cost. And there is no specific treatment for BLV infection or lymphoma in cattle. This makes prevention paramount, since no vaccine is commercially available.
So what can be done?
Strategies include test and cull segregate programs, which have been successful in many European countries. Strict biosecurity measures like using cautery or bloodless dehorning methods to minimize blood transfer, cleaning and disinfecting all equipment between animals, never reusing needles, and controlling biting flies.
This has certainly opened my eyes to the sheer scale and complexity of these challenges. It almost feels overwhelming sometimes. So, looking at this incredibly diverse set of threats, what's the most crucial, overarching strategy to protect cattle effectively?
Yeah, it's a lot. That's really where integrated pest management, or IPM, becomes essential. Think of IPM like being a master chess player against the pests, instead of just, swinging a hammer. It's a science-based approach that combines various control methods to reduce pest populations below economic thresholds, while also minimizing risks to people, property, and the environment. It moves beyond relying on single tactics, like just insecticides, which, as we've seen, can unfortunately lead to resistance.
That sounds like a very common-sense approach, combining different methods. But what are the absolute essential principles listeners should grasp if they want to implement IPM effectively on a farm? What are the core ideas?
Okay, there are four core principles you really need to understand. First, you must accurately identify and assess the pest. Understand the specific type and the magnitude of the infestation. Second, you evaluate control options, considering the strategic combination of biological, cultural, and chemical methods. Third, you implement those chosen strategies appropriately and meticulously. You have to follow through. And finally, you monitor effectiveness continuously. See if your efforts worked and if retreatment or adjustments are needed. It's a cycle of intelligent management, really.
Let's talk about the tools in the IPM toolbox then, starting with chemical controls. They're often the first thing people think of, but we know there are challenges with them, like resistance.
Right. Chemical treatments, using acaricides for ticks and mites, and insecticides for flies and lice, remain common. These products are available in various forms like dips, sprays, pour-ons, and even ear tags. Most are neurotoxins. They work by disrupting the pest's nervous systems. But here's the critical part. Using these responsibly is absolutely key to preventing resistance. This means avoiding unnecessary treatments, following label directions precisely, alternating products with different modes of action to keep the pests guessing, and adjusting dosage based on an animal's exact weight. No guesswork.
Okay. Beyond chemicals, what are some of the other methods in an IPM approach? The ones that aren't quite so direct but are equally vital?
Yeah, non-chemical methods, including biological and cultural controls, are incredibly important. Biological control involves using living organisms to kill pests. Things like releasing parasitoid wasps for flies, maintaining active dung insect populations to break down manure, which naturally reduces hornflies, or even using predatory animals like ducks in some systems. Cultural control and pasture management focus on reducing favorable sites for pest development. This includes regular manure removal, proper drainage to avoid damp areas, and pasture spelling.
Pasture spelling.
Yeah, strategically resting pastures by keeping cattle off them for a period. This helps break the tick's life cycle on the ground. And we can't forget comprehensive prevention, biosecurity, and just general good herd management practices. This means isolating and quarantining new animals for at least 21 days, maintaining a closed herd if possible, limiting traffic onto and within the farm, rigorous equipment hygiene like cleaning all blood-contaminated instruments between animals, environmental modifications like well-ventilated and dry housing, excellent nutritional management to boost immunity naturally, and regular observation for early detection. Even culling chronic carriers of parasites like lice can prevent continuous reinfestation in the herd.
The challenges aren't static, though. They're constantly evolving. It sounds like a constant battle, really. What's on the horizon that makes this fight even harder? And what new solutions are being explored to meet those emerging threats?
You're right, it's definitely a dynamic battle. Two major emerging challenges are insecticide and acaricide resistance, and the impacts of climate change on parasite distribution. Resistance is a significant and growing global concern, fueled by frequent and frankly sometimes inattentive use of chemical treatments. Resistance mechanisms are diverse and can spread rapidly, like a silent arms race between us and the parasites. This highlights the urgent need for careful monitoring and rotation of chemical classes.
And how does climate change factor into this already complex picture? It's not just about rising sea levels impacting farms, is it?
Exactly. What's truly fascinating and a bit scary is that while we battle these tiny enemies, the very planet is shifting the battlefield. Rising temperatures can influence the production and maturity rates of infective agents, like the parasites themselves, and also the survival rate of vectors, like ticks and flies, thereby affecting disease transmission patterns. For example, the geographical ranges of some arthropod vectors are expanding northward, and unexpected winter questing activity of ticks has been noted in the central Midwestern U.S., which is unusual. Climate change can destabilize disease ecology, altering contact between vectors, pathogens, and hosts in ways we're still trying to fully understand.
So, what hope do we have for truly novel solutions in the face of these evolving threats in a shifting climate? It almost feels like a race against time.
Research and development are absolutely crucial. There's significant work on new vaccine development, including third-generation vaccines like DNA, RNA, and recombinant viral vector vaccines. These aim to induce stronger, more durable immune responses than some older vaccine types. Research is ongoing for subunit vaccines against anaplasmosis and BLV specifically. And in vitro culture, attenuated strains are emerging as potentially sustainable vaccine alternatives for babesiosis. Beyond traditional biological agents, research continues into novel biological controls for ticks, such as using specific types of fungal pathogens. Advances in diagnostic tools, including things like microfluidics and image detection techniques, are also crucial. They allow for earlier and more accurate detection, enabling more targeted and timely interventions.
What's your final takeaway for us after this incredibly comprehensive deep dive into cattle external parasites and the diseases they transmit? What's the big picture?
Well, the issue is complex, dynamic, and definitely multifactorial. It's influenced by these intricate interactions between the host animal, the pathogen, the vector, and the environment. It is truly an economic necessity for the global livestock industry to invest in robust control and prevention programs. What's fascinating here, I think, is how age-dependent susceptibility for diseases like anaplasmosis and babesiosis means targeted management can be really effective, like controlled exposure in young animals in certain endemic areas, potentially building immunity safely. And the long-term carrier status of many infected animals, whether with anaplasmosis, BLV, babesiosis, or trypanosomiasis, is a critical factor in disease perpetuation. This really underscores the importance of accurate diagnostic testing and strategic herd management.
So it's about far more than just treating individual animals when they get sick, isn't it? It's about a complete strategy.
Exactly. Strict biosecurity measures are the absolute cornerstone, especially where effective vaccines are unavailable or limited. And the growing challenge of acaricide and insecticide resistance absolutely necessitates a shift toward comprehensive integrated pest management strategies, combining established practices with judicious chemical use, innovative non-chemical methods, and a real commitment to ongoing research and adaptation. We can't stand still.
It sounds like a constant evolving battle that impacts far more than just a single cow or a single farm. It's much bigger than that.
It really is. The ongoing need for research into novel vaccines, alternative biological controls, and adapting to climate change is paramount. This isn't just about protecting animal health, it's about safeguarding global livestock economies and ensuring food security for us all. It's a powerful reminder, I think, of how interconnected the health of our planet, our animals, and ourselves truly is.